Cape Town's Groote Schuur Hospital is again leading the pack in excelling in public health care. It will become the first state facility in Africa to introduce robotic surgery. Surgeons are already hard at work getting to grips with using their delicate machine that will increase recovery time for hundreds of patients who need complex treatments. Lindsay Dentlinger went to see a demonstration.
Hundreds of surgeries are performed here each year. The coronavirus pandemic forced Groote Schuur Hospital to put more than 2,500, often life-saving surgeries on hold.
We don't want to call it catch-up or addressing the backlogs, because we actually need to find a novel way of addressing this problem of having lost so much due to COVID, and we're working on that. But it will mean that we will be doing extra theatre lists.
While older generations of the Da Vinci robot are already in use at some private hospitals, this 38 million rand fourth-generation machine makes it the best at the job and the first to be used in a state facility in Africa.
After 20 months of COVID, we need things like this just to uplift our staff, but also to show that we remain at the cutting edge of innovation. We're still committed to patient care that's non-COVID related.
The robot is capable of performing a range of abdominal surgeries, but will particularly be useful for urological, colorectal and urogynecological procedures.
The robot will make a huge difference to us in terms of the minimally invasive surgery that we offer. We already have the country's only laparoscopic radical cystectomy series, and unfortunately the results are limited by things which are not really possible in normal laparoscopy, and that is doing the reconstruction of the urine system after the radical cystectomy inside the patient.
Once accredited, the selected 10 surgeons will have to first perform operations under the watchful eye of a proctor before being allowed to operate solo.
The radical prostatectomy is the poster child for robotic surgery because it is one of the procedures which has been shown to have lower complication rates, lower bleeding rates, lower hospital time, and definitely less days with a catheter post-op as compared to other modalities of doing exactly the same operation.
Surgeons will now undergo several months of training to learn to use this world-class robot. If all goes according to plan, the first surgeries using the Da Vinci will be performed in this hospital early next year. Lindsay Dentlinger, Groote Schuur Hospital, Cape Town.